Respiratory syncytial virus, or RSV, is a leading cause of infant hospitalizations in Canada. That's according to data from the Canadian Institute of Health Information. And we're currently in the peak of RSV season in Canada. So this morning, we're joined by pediatric infectious diseases specialist Dr. Katharine Smart to explain why RSV is so serious for infants and what parents should know about protection options. She's joined by Katrina Bellevance, whose baby was actually hospitalized as a result of RSV. Good morning to you both. Thank you for joining us.
Good morning.
So, Dr. Smart, I'll start with you. For parents who may have heard of RSV but don't know much about it, what is it and why is it such a serious concern for babies?
So RSV is a common virus in our communities, and for older kids and adults, it tends to cause a common cold. But in younger children, particularly infants under 6 months, it can be very serious. It's a leading cause of hospitalization in children under 12 months of age, and many younger infants that get RSV can become quite ill, needing oxygen and sometimes breathing support, and it can be really terrifying for families.
Right. It does sound really scary. Katrina, you've lived through this as a parent. Can you tell us what it was like when your baby was actually sent to hospital with RSV and what you had wished you'd known at the time?
Yeah, it was really scary. I knew RSV was something to be cautious about, but I didn't fully understand what the danger could really look like, or how quickly things could escalate. I wish I'd had a broader understanding of what the symptoms to watch for were, and what would necessitate an emergency room visit. It had to be a very last minute decision to get her oxygen support. There's trusted sources like Praxis Health that have info, and hopefully can help parents avoid the situation that our family was put in.
Right. Can I just ask you, what were some of the symptoms that your child went through, Katrina?
Yeah, she had no symptoms to begin with. And all of a sudden in the middle of the night, she couldn't breathe. So it turned serious very quickly for us.
That does sound very scary. Dr. Smart, what can parents do right now to help protect their baby during the second wave of RSV season?
Well, the good news is we now have Health Canada approved opportunities for prevention, both through maternal vaccination that can happen late in pregnancy and protect the baby once it's born, as well as monoclonal antibodies, which are given as an immunization to babies when they are born. Across the country, access to these things can look different. Provinces like BC and Alberta are only providing the infant form to high-risk pregnancies or high-risk babies. Other places, they have a publicly funded program for all infants. So the best thing for families to do is to speak to their healthcare provider, find out what's available where you live, what your options are. And the good news is there are things now that we can do that we didn't have before.
Absolutely. What are some symptoms parents need to be on the lookout for, whether it's in their child or in themselves?
As we heard, the biggest thing to be watching out for in your baby is troubles with breathing. You know, infants basically like to sleep and eat. So if your baby's seriously impacted, you're going to see difficulties breathing that impact their feeding. They may be sleepy, not waking up normally. You may see work of breathing, which is distress with their nose flaring, breathing deeply between the ribs, breathing quickly. These are all signs that you should get to the hospital and have someone have a look at your baby and make sure that they don't need more support.
Absolutely. Obviously, some parents may hear the word immunization or vaccine and have some questions. So what should they know about the safety and use of RSV protection options really quickly here?
Yeah, that's an important question. We know that there's vaccine hesitancy. That's why speaking to your healthcare professional or provider is so important. These options that we've been talking about, maternal immunization, infant immunization, are Health Canada approved. There's excellent data showing safety and efficacy in terms of preventing severe disease. So these are safe products that are available to families. Speak to your healthcare provider, find out what makes sense for you and your family and your situation. And it's great that these are now options that are safe and available in Canada.
All right. That's Dr. Katharine Smart, pediatric infectious diseases specialist. Thank you so much for your time with us this morning, and thank you to you as well, Katrina, for sharing your family story. I hope you both have a great day, and people can find out more over at the website that you had mentioned earlier. So thank you both again for your time.
Thank you.
All right, Carrie, back to you.